Hi everybody, my name is Gregory Lemkine. I'm the director of Watchdog Laboratory, and I'm very happy to present you some feedback on the validations of the three different test methods that we have developed. The TG248 as the XETA for the thyroid activity assessment, the TG251 for the radar and androgenic assessment, and the draft test guideline REACTIV for estrogen activity assessment. So these validations were organized ourselves as a coordinating lab. Watchdog is a spin-off from the French CNRS and the Museum of Natural History in Paris. We hereditated from this know-how and the science from the academic lab where originated from, which title was Evolution of Endocrine Systems. And Watchdog has dedicated research and development activities to validate methods and to transfer these technologies to the industry. To perform these R&D activities, the research team is composed of 3 PhDs, including myself, animal technicians, lab technicians that are dedicated to develop methods, which resulted since 2006 in 40 scientific publications. We trained 19 labs since 18 years, and we performed, for these 3 different methods, we performed 4 ring test assays coordinated on 3 different continents. So these validations were by ourselves. Financial resources of Watchdog come from national, French, and European grants, research grants, but also loans from the French Public Bank for Innovation, BPI. I should mention that all these loans have been reimbursed since. And we are also and mostly supported for our research activities by fee-for-services that are sponsored by the industry, and also the support of our private investors, individual persons, as in the form of private equity. I should also mention that all these activities led to financial resources, and that are also used to pay royalties, annual royalties that are paid back to the French institutions where originated from. In terms of management design of these validations, well, many laboratories were involved across the 3 methods. 16 labs have been involved, and sometimes in more than one method. And I'm sorry, I thank you really all these labs for their help and their involvement. I won't go through each of them, of course, but I just want to mention, as you can notice, they are located on 3 different continents as required by OECD procedures. These labs had to test on each method a common set of chemicals with positive references that were used to assess transferability of the method, and also that was including a set of negative inert compounds to assess specificity. And of course, each lab had the option to decide to test an additional set of chemicals that we recommended, but they could also add their own suggestions to increase the assessment of the performance of the method. So these chemicals were selected and provided to the lab. So in terms of the choice of chemicals, the first important criteria was to cover the different mechanisms of each endocrine pathway to really determine the coverage in terms of mechanisms and the limitations of each model for these very specific endocrine mechanisms. There was also the difficulty of identifying true inert compounds, because very often we lack any endocrine data on these compounds, on these non-active compounds. And then also among the criteria, we preferred always to have chemicals that were easy to handle in terms of solubility in particular. And also we took into account, of course, the cost and the accessibility. I just want to mention the case of NH3, which is one of the very, very few antagonists of the thyroid receptor. So we had to go through synthesis to provide this to different participating labs. In terms of supplying the chemicals, we always prefer local and regional suppliers, in particular to avoid the difficulties of shipping over borders. And in terms of collecting the data, because we couldn't really code or decode the chemicals, but I should mention that each data was acquired blindly, because each of these methods are based on imagery, and so once the images were captured for each group, it is impossible to change the data, and it was not possible to really relate the chemicals to the pictures. So that was performed afterwards, and then the independent expertise of the statistical experts that are working usually with OECD was also of great help to perform the analysis. The main organizational challenges, well, I have to mention that endocrine disruptors, as you may know, is a hot topic, and so it turned out that we had a competitive situation with a similar method. So thankfully, UK and Japan accepted to co-lead the proposal to avoid any potential conflict of interest with parallel methods. And finally, the validation process really helped to demonstrate the advantages and limitations of each method, and that was, of course, very helpful to better define which the specificities of each method and their usage. Talking about adapting the methods, I should also mention the importance of the support and the expertise of OECD experts, in particular BIAC for the industry and ICAPO for animal protection organizations. This was very helpful to fill the gaps in terms of what would be expected in terms of regulation, but also what would be expected in terms of ethical efforts and ethical advantages of these embryonic methods that can be assimilated to both in vitro and in vivo. I would just mention that some authorities, unfortunately, were not involved, as far as I know, in the validation process. And after the first method, the XETA for thyroid activity assessment, was published, thankfully, ECA and EFSA published a guidance on how to implement the method in a regulatory perspective, and that was very helpful. A main financial well, the budget was supported by each participating lab, and we were lucky to have in France and in Europe easy access to innovation funds that supported a lot the involvement of academic labs. As you've seen, most of the participating labs were from academia, with the strong interest of publishing results, of course, but also using the methods for their own research projects. Another point is the heavy cost of chemical analysis, which is much higher than the method itself usually. And on that, I should thank the industry for their sponsoring to cover these expenses. So altogether, the success factors and what could be improved, well, I would say Um, we were successful also because we had this strong advantage of the desire of getting the method to the market. And I think that put us in a very favorable situation to have this will to succeed. And so I would suggest to have in the future better support to SMEs involved in these validation processes. Also, maybe more involved contract research organizations who will be very helpful to provide accessibility to the methods. And also, I think each country member should take into account the importance of these methods for the competitiveness and keep in mind that in different parts of the world, these test methods are access keys to markets. And finally, I would say that maybe focus should be made on better address the regulatory gaps in the validation processes, and that would require to have a better involvement of authorities, agencies in this process. So much, and of course I'd be happy to help, and you can contact me if you need more details. Thank you very much.